People often say, use it or lose it. But does that really apply to your sex life and your body? Today, we're going to break this down for both men and women. You'll learn what actually happens when you're not sexually active. And trust me, the science might surprise you. Why people believe use it or lose it. A lot of men and women feel anxious if they're not having sex regularly. They worry, am I damaging my body? Will I lose function forever? And honestly, some research does suggest that people who are sexually active more often have better erections, better lubrication, and healthier tissue. But here's the catch. Those studies are usually biased. Why? Because people who are healthier overall tend to have more sex in the first place. So the real question is, if you're otherwise healthy, but just not having sex, does your body really suffer? What happens to men? For men, studies show that guys who have regular sex may keep better erectile function as they age. But here's the important detail. Men who are already struggling with erections often avoid sex because they're embarrassed, not because not having sex caused the problem. Now let's talk science. Even if you're not sexually active, your body protects you. At night, men naturally experience 3 to 5 erections while sleeping. These are called nocturnal erections, and they help deliver oxygen-rich blood to penile tissue. Why does this matter? Because that fresh blood flow keeps the tissue elastic, healthy, and functional. If those nighttime erections stop, maybe due to poor circulation, diabetes, or low testosterone, then yes, scar tissue, fibrosis, can form over time. That makes erections weaker and even causes shrinkage. So the real risk isn't not having sex, it's not getting erections at all. That's the moment men should get checked by a urologist. Ejaculation and prostate health. Here's another interesting finding. One study showed men who ejaculated 21 times or more per month had a lower risk of prostate cancer compared to men who ejaculated only a few times a month. Now, does that mean you must ejaculate that often? No. But it does show that regular release can have health benefits. Sex and ejaculation also seem to play a role in maintaining healthy testosterone levels. It's a two-way street. More testosterone boosts desire, and sexual activity helps signal your body to maintain healthy hormone balance. And don't forget, every orgasm also contracts your pelvic floor muscles, which are crucial for sexual and urinary health. What about women? Now let's flip the coin. For women, regular sexual activity helps maintain vaginal elasticity, natural lubrication, and healthy blood flow. Women who stay sexually active often experience fewer issues like dryness or vaginal atrophy after menopause. But again, here's the nuance. Women who already have discomfort, pain, or dryness may avoid sex, which makes it seem like less sex causes the problem, when in reality the problem was already there. The good news? Solutions exist. Vaginal estrogen can safely restore tissue thickness and elasticity. Moisturizers and lubricants make sex more comfortable. And yes, vibrators can also help increase blood flow and keep tissues responsive. Just like men, women also experience 3 to 5 episodes of genital blood flow at night, even without sexual activity. This natural process helps keep tissues healthy, unless health problems like diabetes or high blood pressure interfere. And similar to men, orgasms in women also strengthen the pelvic floor, which is especially important after childbirth to prevent issues like leakage or urgency. The bigger picture. So, is use it or lose it true? Yes, but only if your body stops creating natural, nighttime erections for men or blood flow to the clitoris for women. No, simply not having sex for a while won't automatically destroy your function. What really matters is your overall health. Keep blood pressure and cholesterol in check. Avoid diabetes. Exercise regularly and eat well. Sleep enough and manage stress. Fittest men and women in their 70s, 80s, even 90s often don't do anything special for their sexual function. They just keep themselves healthy. The hidden benefits of sex. And let's not forget, beyond erections or lubrication, sex brings other health perks, boosts brain function, lowers stress, strengthens emotional connection, may even extend lifespan. People with more frequent sex tend to live longer. That's something no lab test can fully measure, the power of human connection. Use it or lose it is partly true, but the real key is keeping your body healthy, so blood flow continues naturally, whether or not you're sexually active. Have sex if you enjoy it. Don't stress if you're in a dry spell. But if you stop noticing nighttime erections for men or arousal response for women, that's your sign to check in with a doctor. If this cleared up a huge myth for you, hit that like button and subscribe for more science-backed breakdowns on sexual and overall health. Now tell me in the comments, do you believe in the phrase, use it or lose it? Why or why not?